Nigeria has the highest estimated incident TB cases in Africa and the fourth highest in the world, with 11% estimated among children. Today on Sound Health, we are looking at how to eliminate tuberculosis in the society. I'm Olasunbo Modupe. Welcome to the show. It's still Sound Health on Lagos Television, and today we are looking at how to eliminate tuberculosis in the society. And I have with me fiekert, a TB consultant, and she's in charge of health system and solution for KNCV Tuberculosis Foundation, Netherlands. Welcome to the show.
Thank you very much for having me, and thank you for your interest.
Okay. Tuberculosis was discovered in the 80s, and unfortunately, much more than 80s. Unfortunately, people still refer to cough, ordinary cough, as tuberculosis. What's your take on this? Why is it so?
Well, tuberculosis is one of the oldest diseases actually known to mankind, and interestingly enough, I mean, they found it even in the old pharaohs in Egypt. So it has been the burden of mankind, and I think people fear it. And because of fear, people will label everything that could potentially be tuberculosis because people are afraid of dying. They've seen people, most people in this society will have known someone who has been infected, has suffered, has died. So I think there's just a big amount of fear and stigma.
Looking at data, we have a report that Nigeria has the highest number of incident TB cases in Africa and the fourth highest in the world. Why is this still so? Is it a challenge in the world?
Big challenge in the world, and in many countries are in a similar situation. I think Nigeria, because of being the largest country in Africa, just by population size, you have a much bigger problem. Also because access is still an issue to services, and people don't know what to do if they have cough. And because they're afraid and the stigma, they might not seek health services. There is a big access barrier to treatment. We estimate that Nigeria probably accounts for 40% of the world's missing TB patients. That's the people that haven't been found and put on the right treatment, which is sad because TB is very well treatable, and the sooner you find it, the better it is to treat.
Okay, could this be attributed to myths and misconceptions about the disease?
Absolutely. I mean, that is one of the biggest problems, is that people think either, oh, I've got tuberculosis, so I will die anyways. Okay. People don't know it's curable. People don't know how it affects their long-term prospects. Everybody hopes it goes away. And of course, if you look outside, it's quite dusty. So people are used to coughing all the time, so they might not even notice. Or people might smoke and they think, oh, it's a smoker's cough. Oh, it's the dust outside, it's the weather, it's the cold, it's the hot. So people don't recognize the signs and symptoms, but it's quite important that if anybody has cough for more than 2 weeks, that they just get checked out. And it's not a big deal, it's not a great problem. If you catch it early, it's very easy to treat. TB is curable, and that's why we shouldn't see people dying of the disease any longer.
It's sad to know that 11% of the cases reported are attributed to children. Why is this so? Why do we have kids having this disease?
Well, children are more susceptible. I mean, just by their physiological makeup, and because children are together with adults who might have the disease and it might not be known, they are much more easily infected. Their immune system isn't that strong yet. That's also why you see it in the elderly. Their immune system is getting less as you get older, or you might get diabetes, or you might have other issues. And then, you know, you're just more susceptible. But the problem with children is that it's slightly more difficult to diagnose in them, just because they can't cough up sputum that easily. And that's how we normally diagnose. So we're trying to find new ways of easier diagnosis in children, and technology has advanced a lot. We've got a new test coming out that looks at stool samples for children, much easier than coughing up or being induced for cough, which is a bit traumatic for children. So we're trying to make it easier, less painful, less frightening for the children to be examined.
Can you please take us through the treatment regimen for tuberculosis to, you know, dispel the fear of people?
So basically, if you're diagnosed with tuberculosis, all that will happen is that you get 6 months worth of medicines. You start with a combination drug, which includes 4 drugs for the first 2 months, and after that you've got 4 months of a sustaining therapy. What's really important about that is that people stay on the 6 months, and even though they feel better, they will feel better fairly quickly. Most people report that they're better after 2 weeks. But it's important to continue, because tuberculosis is a bit of a sneaky little bacteria which lurks around and it bides us time, and it's a quite tough one. So you need 6 months to treat it through, and then you're fine. It's slightly more complicated if you do not get prompt treatment, because you might have drug resistance TB. So if you get infected by someone who had treatment before, or because the TB bacteria, because they're clever, developed resistant to the antibiotics, as we see quite often nowadays, then it takes longer. It's still curable. It just might take longer. You might have 9 months treatment, or 12 months treatment, or 24 months of treatment. The drugs are a bit more harder to take, because it's more of them that you need to take. But there is no reason that anybody should die of TB. I mean, TB is always curable. And even if you hear in the press there's something like super drug-resistant TB or totally drug-resistant TB, those definitions aren't quite right, because we have a good set of drugs nowadays to treat, and the most important thing is that you are diagnosed and that you get the treatment, and then you are fine.
One would attribute the more reason people do not want to access treatment due to the long-term nature of treatment.
The alternatives are quite stark. I mean, you either take your medicine, or you will die, or at least have severe disability because your lungs get damaged, and then you can't get up the stairs, or you can't really go about your daily life. The treatment has become much better. We hardly ever use injections nowadays. It's all about, you know, one tablet. The drugs are combined in one big tablet to take in the day. So it's not that difficult, and it's really important. And I mean, if you would be diabetic, you would give yourself insulin every day, and you do that for the rest of your life. If you're HIV positive, you will take drugs until the end of your life because you don't want to die. So I think people need to overcome that fear and the being bothered by the medication. It's well worth it, and it's documented, and you know, if you delay it, it's going to be worse, because then you will have long-term effects and problems. If you get diagnosed early, you have treatment early, you're fine.
So if you're to rate the response rate, and if you to compare where the project started and now, what's your rate?
I mean, lots of things have happened. I mean, we have enrolled at the moment 60 facilities. So that seems very small in the vast number of facilities, but as I say, we are building a model here, and we're working very closely with the national programs to make sure that the systems are within their policies and guidelines, and that they follow their standards. At the moment, when we started, there were 150 facilities that already collaborated with the national program. Through the interventions, another 186 have signed up within the period of 2 years. That's still a small number, but it's now accelerating because people see the value of the program. So that means more private practitioners will work with the national programs for TB and HIV and get certified, provide good standard care. We've seen a significant increase in case notification, so more people have been detected and be put on treatment, more people have completed their treatment. Another side effect that we weren't actually expecting was the national guidelines say if you are presumed to have TB, then it would be good to also check if you've got HIV. And this is not to stigmatize people, but it is because if you have HIV, then it's very important that you receive ARVs, because we know that if you take ARVs, you have no more viral load, you're no longer infectious, and you will live. The data is very, very clear on that. So WHO and the rest of the world has really pushed that everybody should be tested, because then we can give you appropriate treatment. And in TB it's important that you get ARVs, because otherwise I treat your TB, you're cured, and you get infected again tomorrow. We don't want that. So we basically made sure that people got tested, but we found out in the program that private clinics didn't have access to testing kits. So we then did talk to the government and said, can you provide test kits to private providers? We can show you what the outcome is. So when we started this, there were less than 57% of private facilities that would test people. Now it's 97, 98% of people know their status and get the appropriate treatment. That's a huge success. I've never seen that anywhere else. So this is a very, very good.
Have you also tried engaging the public hospitals in Lagos State? What has been the response rate?
This project is not working with the public sector, other than that we are cross-referring people, but we're not really engaging with them because they're covered by other programs. So there's a number of other programs like the Challenge TB project that deal with the public sector facilities. We really see the Building Models for the Future project as an add-on. We're covering an area that wasn't covered before.
As we wrap up this segment, what are your expectations for the programs? You know, the program is rounding up soon. What are your expectations?
We had a really good response from all the partners, and we just had an evaluation running to see what the net results are and what worked well, what didn't work well. There's still a few problems that need to be figured out on how you best transport samples, for example, from a private practitioner to a facility that can test with the latest technology, because not every private doctor has got the facilities. But the response was really good. The NTP, so National TB Programme, have taken this project really on, and they want to see this grow, and they've used the tools and guidelines developed together with the programme, and they now want to integrate that into their normal activities. There's funding from the Global Fund, which will pick up some of the things. There's a project from USAID called the Schuts project, which also works with private practitioners. So they will now roll this out. So we should actually see a great increase in engagement of private practitioners into this project in the near future, and it should become the standard. It will be adopted into the health insurance system. HIPAAMA has already been involved in this, and they've used the standards that were introduced as their standards. And it really, we've done our work. We've created a model, and we're now handing it over to the partners. But we're not going away. I mean, we're hanging around as an organisation.
Is key.
Yes, and we want to see, and we want to learn, and we want to see what areas still need to be addressed. So. But it's now ready to be handed over, which is great, and you should see the fruit very soon.
Your final word to viewers regarding TB?
I think my final message, and I've repeated that several times over, don't be afraid of TB. TB can be cured, it should be cured. If you've got any inkling that you might not be well, be it that you have got cough for more than 2 weeks, or you've lost weight and you don't know why, you have night sweats, you've got fevers, go and see a doctor, be tested. It doesn't hurt to be tested. It will give you peace of mind, and if you should be found to have TB, then you get the best treatment there is. And in 6 months' time, you're going to laugh about it. and you can live happy and well lives.
Okay, thank you so much, Casey, for sharing your perspective on eliminating TB in the society.
Thank you for having us and for showing your interest.
Okay, all right, that has been Casey Fiekert, Senior TB Consultant, KNCV Tuberculosis Foundation, on how to eliminate tuberculosis in the society. Soundhealth continues. Please stay with us. The program continues in a moment. Okay, it's still Soundhealth on Lagos Television, and earlier on I spoke with Casey Fiekert, the Senior TB Consultant, KNCV Tuberculosis Foundation. She has been sharing her perspective and giving insights on how to eliminate TB. And I have with me the portfolio manager, Schuts, and she's going to take us on improved tuberculosis and HIV care prevention. Welcome to the show.
Thank you very much.
All right. Can you please take us through the DGIS fund project? It's a 5-year project, and what does this mean for tuberculosis control in society?
Yeah, so we're very happy that we're funded by the Dutch Ministry of Foreign Affairs for this project for 5 years. And it's a project in 3 countries, in Kazakhstan, in the Philippines and in Nigeria. So today we are in Nigeria, and we are in our final year of project closeout. So next to that we call it Pillar 1, that's the building models for the future, and that focuses on improved TB HIV care and trying to get the private sector and the civil society and the government all working together to eliminate TB.
Okay, why did you choose Nigeria?
Well, KNCV already is working in Nigeria, so that's one reason. So we have a big office here in Abuja, that's where the main office is, and then some regional offices, of which Lagos is one. And our partner in this project, Farm Access, is also working in Lagos, and they were already working on some interesting developments in digital health care, and you might have heard of it, of the health insurance scheme that they're working on together with the Lagos government. So that seemed like a very good entry point for these 2 Dutch development organizations in this project. And of course we also know that a lot of the patients with TB actually find treatment in private facilities. So it's very important to make sure that they are working well together with the Lagos state government and also with the civil society.
How related is TB to HIV? Because I understand you are also looking at HIV prevention and cure.
Yeah, they're actually very related, so that the people that have HIV are very susceptible for TB because their immune systems are already weakened. So it's actually a big problem, and that's why it's nice to combine sort of these 2 diseases in this project and work on them hand in hand to try and solve it.
Okay, so has the project complemented other intervention programs when you talk about tuberculosis and HIV prevention in the States?
Yeah, I think it has. At least we have a very relatively small project, but we build upon other projects that are here. For instance, in KNCV we have the Challenge TB project that is also working on sputum transport, so getting the sputum from the facility to the laboratory to get tested. So we're tapping in to some of the activities that they have. And the Safe Care program from Farm Access is actually focused very much on the overall facility. So they don't only look at TB or at HIV, they also look at maternal health, they look at waste management, infection control. So they measure sort of the standards in these facilities on all those levels, and then hopefully by the end of the project that is all improved and should lead to improved TB HIV.
What scheme have you put in place to encourage people to go for voluntary testing for TB, tuberculosis and HIV, because that's a key issue in all of this projects?
So the project is also focused a lot on developing materials, so education and information materials. And not only we have developed them, but we're also using those materials from other stakeholders, so that those are pasted in the facilities. Well, TB drugs are free, so that is very important for people to know.
Maybe you need to emphasize on that.
Yeah.
I think most people don't know TB drugs are free.
Yeah, exactly. So that's a very important aspect, and also in the private facilities these are free. And I think that even KNCV in the work we do in Nigeria is trying to do a lot of outreach activities. So there's a toll-free number that people can call when they have symptoms, or they think they might have TB, where they can get the information. There's also on radio programs. We're very happy that you're giving us the opportunity today, of course, to speak on these important issues. So I think that's indeed a very important point.
The project is a 5-year plan. What plans are you putting in place to ensure follow-up?
The plans we put in follow-up is actually working very closely together with another USAID-funded project, Schuts, who is working with private facilities, and they have started, I think, a year ago or something. So we made sure that we handed over all our tools and all our SOPs that we developed, so our standard operating procedures. And we are taking the last months of the project. We've worked very closely together with them to ensure that they can take over as part of the work that we have done, and of course also the Lagos state government. So the government has been going with us on supervision to these facilities over the last 5 years, and we are very confident that will continue when we leave. Now this project is of course finished, but the KNCV office will still be here in Lagos, as well as the Farm Access office. So we're still working on many interventions in Nigeria.
As we round up this segment, what advice do you have for viewers at home regarding tuberculosis and HIV treatment?
Yeah, thank you for that question. So my advice is to indeed always, when you have coughed for more than 2 weeks, go to the facilities or go to some community workers in your facilities who can link you to these programs. So I encourage everyone to call the toll-free number, which is 0800-2255-282. And please seek care, because TB is curable. So there's drugs for that, and you take it for 6 months, and you should be able to live a very healthy and happy life.
Alright, thank you so much, Kelly, for giving insight on how to cure tuberculosis and improve HIV prevention in the state.
You're very welcome. Thank you for having us.
Alright, thank you so much. The program continues in a moment. Please stay with us. If you have cough for more than 2 weeks, please visit the nearest health facility. Remember, tuberculosis is curable and treatment is free. That ends Soundhealth this week. For comments and inquiries, please visit our website or follow us on social media at HealthyWithSocial, #Soundhealth. A sound health is a sound mind. Make healthy living your choice.